In the recent past, people of the scenic Swat Valley and its surrounding areas have witnessed a war against terror, when the Pakistan Army was engaged in flushing out the Taliban fighters. Soon after the military operation, people were asked to come back to their homes. Life was returning to normal at a slow pace. Security, reconstruction, livelihood, health, and education were the main tasks, though for a common person, the task was just to survive, which was not possible without the help and support of others. In March, the Swat Relief Initiative, or SRI, attended the US-Pakistan Strategic Dialogue at the State Department. In May 2010, the SRI sent its president Zebo Jalani with the task of setting up a community health center for women and children with these funds. Zebo's family, the former rulers of Swat, donated a building to SRI to train lady health workers and lady health visitors in preventive health care to improve the health of women and children in the area. The goals of this project are to improve maternal health, reduce infant mortality, and prevent major diseases in a population that has been ravaged by the bitter fight in the area.
Our preventive healthcare program is involved with improving maternal health, and I decided that since we are going to be referring people to the maternity ward, I would have a look at it and see what condition it was in. And when I went to the maternity ward, the condition there was atrocious. There were small, tiny beds that the women had to stay in. The birthing beds were really small. The women's feet were falling off. The people, the nurses and the doctors did not have a humane treatment of the patients, and they would just abuse them. They would slap them. And I just stood outside the door and I was horrified because I couldn't believe that people would treat patients like that in a hospital.
Perhaps the most significant of the recent achievements is the SRI partnership with the Human Development Foundation, which is providing the technical support and expertise for running the SRI Community Health Center for Women and Children. The HDF team and Swat Relief Initiative have been working diligently hiring and training the staff for their preventive healthcare program in Swat. The building for a community health center is ready for use, and our teams of lady healthcare workers are now busy in the field, teaching women about preventive healthcare, hygiene, and nutrition. We were in the middle of setting up our preventive healthcare program when the region was hit by disastrous floods that badly damaged a vast area along the Swat River. Infrastructure was swept away, and so were the cultivated lands and fruit farms. This disaster diverted our attention to flood relief for thousands of flood victims in the form of rations, cash for building homes, medical camps, and health seminars in order to prevent disease and malnutrition. The UN Secretary General Ban Ki-moon has called the devastation in Pakistan the worst he has ever seen. Apart from huge casualties and devastation from record rainfall and the resulting floods in the Swat Valley, the tourism and agriculture sectors have been completely ruined. Hundreds of homes, shops, hotels, schools, and vehicles have been swept away by the gushing floodwater. The standing crop of rice, maize, onions, and vegetables has been destroyed. Orchards of pears, apples, and nuts have been damaged. This disaster, the worst ever in Pakistan's history, has set us back many years. Priorities have changed in this catastrophic situation. Survival needs like food, drinking water, clothes, and shelter are immediately necessary, whereas health, education, and reconstruction come later.
Well, we do have limited funds because we depend on small donors, but recently we've had some big donations, like from Abbott Fund. They've been very generous. They sent us a grant of $40,000. But what we try to do is we try to use people's money very wisely. Our organization has a policy where we are all volunteer force, and we try to give 100% of funds to the people in Swat, and whatever little overhead that comes, we try to pay it from our own pocket.
The task is enormous, and we can use all the help we can get. The hapless victims of these horrendous serial calamities are now looking for our help and for you to step forward and support their path to survival.